the term PPE lately, or personal protective equipment. Basically, when you're talking about the COVID-19 virus, or the virus that causes the COVID-19 illness, I think there's a little bit of uncertainty in the whether or not it's going to be airborne. Some people say yes, some people say no. Now, let me tell you the difference between what a droplet infection and an airborne is. Influenza, the virus that causes the flu, is droplet, okay? And that means that it's really going to be contagious. When I say droplet, you have to be within close proximity. When someone coughs or sneezes, droplets come out. Airborne would be when someone speaks or breathes. And airborne particles are very, very tiny, and they can travel and linger and float around and stay in the room. Something like influenza would be, like I said, droplet. So if you walk in a room and someone is just talking and you pass through, chances are you may not get it. But if you get within, the social distancing, 6 feet, that's when you become susceptible for droplets. But that being said, influenza is highly contagious. Now, on the other end of the spectrum, we have something like measles, rubella, tuberculosis. That would be an airborne infection. That would be, you walk in the room and you don't have a respirator on, you're not safe. It doesn't matter. There's no social distancing. You're in the room and it's a closed room with poor circulation. Chances are you're going to catch it. So it's highly contagious. COVID is somewhere in the middle between something like tuberculosis and influenza. It's more contagious than influenza, but not quite as contagious as something like tuberculosis. Here's the thing, the problem with finding protective equipment. There's none available. It's not available to the general public, and the CDC doesn't recommend the general public utilize protective equipment anyway. And any equipment that they will have goes to the hospitals, the front line, the people that are working with the sick. Now, that's not saying that someone like a facility like the Bridge House couldn't benefit from having this equipment, but the likelihood of us ever acquiring the equipment is pretty low at this point. Especially and I'll talk a little bit about the face mask. Okay, so the CDC is saying cover your face. Cover your face, it doesn't matter what you use, anything's better than nothing. We have these Niatosh N95 respirators. A respirator is very specific. It's made out of very specific material, and it fits the face in a very specific manner. So for you to get a respirator right now, it would be impossible. And if you do have a respirator, you have to do a fit test. And it has a seal on it. Now, the respirator will block out small, tiny particles, and even the hospitals are not having not using all the respirators that they really should. For COVID, they're using, and you pick your equipment based on the precautions. So they're basing it on airborne, droplet, and contact precautions. What do I mean by contact? Contact would be something like, I'm touching a person, bodily secretions get on me, and I rub my face. Or contact could be, I touch a doorknob that someone touched that had some of the secretions with the virus on it, and I rub my face. That's contact. Droplet would be, I'm within within 6 feet of a person and they sneeze and cough and I breathe it in and I inhale it, it either goes into my eyes, my nose, or my mouth. I can catch it that way. And then airborne, like I said, is tiny, tiny droplets, microscopic droplets, that even if you're wearing like a surgical mask is considered protective equipment. An N95 mask is considered protective equipment. A cloth mask that you make at home is not. It's not technically considered protective equipment, nor are these examination masks that you see a lot of people wearing. Those are not considered protective equipment. Now, I'm not saying they're not useful. I'm not saying don't use them, because they're not pointless, because they do block a lot of the growth secretions. So when someone does go and they do don something like a respirator, it's usually, right now they're reserving that for when they go in there and they're going to do procedures that stimulate a lot of secretions like coughing or breathing treatments, things like that. That's when they're going to use those respirators. They're not going to use it just for routine care now because they don't have them. So they are turning to the surgical mask more because those are a little cheaper and easier to manufacture. With that being said, and I'll just tell you, I'll give you the personal protective equipment is specialized clothing or equipment worn by healthcare workers for their protection and to help prevent the spread of germs between patients. PPEs include, but not limited to, gloves, gowns, goggles or face shields, face masks, and respirators. PPEs do not guarantee total protection, and they must be used in combination with precautionary measures such as hand hygiene to be most effective. PPE used improperly, such as taking off a PPE, can provide a false sense of protection and potentially lead to self-contamination. Now, I don't know if you want me to go over all the different types of PPEs, and I don't have all the PPEs to do a demonstration on how to don them, but there is a donning sequence. And I mean, I'll go over that real quickly. If you're gonna don PPEs, say you're gonna go into a room with someone that is known COVID, the first thing you want to do.
Billy, just real quick, I think what's more important for us is just what we need to do. So
okay,
in our situation.
Okay, well, I'm gonna stick to what we need to do. So I'm gonna base it on face mask or cloth mask and gloves if you choose to wear gloves. First thing you want to do before you ever put on a mask is hand hygiene, or wash your hands. Wash your hands with soap and water, and you want to wash them at least 15 to 20 seconds, 20 seconds preferably. If you don't have access to running water, hand sanitizer. And I don't know if y'all could see. Well, it'd be hard. Hand sanitizer is real simple. And the way that you put it on, you want to put about the size of a quarter, and you want to rub it in. Rub the backs of the hands, palms of the hands, in between the fingers, around the thumbs, around the wrist, both wrists. And then you don't want to forget the fingernails. You want to rub your fingernails in a circular fashion. Make sure you get all between all the cracks. And really, when you're using hand sanitizer, you want to continue to rub it until it's completely dry. You don't want to take a paper towel and wipe it off, because it has to dry for it to be effective. And it is highly effective. Now, if your hands are visibly dirty, they have dirt, they have grease, they have things that, you know, are visible on it, you want to use soap and water first. So after you do your hand hygiene and you clean your hands very well, the first thing you want to do is put on your mask. Now, this is just an examination mask. And if you notice at the top, there's a little metal rod that goes through the top of it. That's meant to go on the top of your nose. So you'll take the mask and you want to fit it around the nose. Fit it around the nose and then pull over, and then you want to pull down and make sure it covers your chin. And you want to make sure that you're covering your nose. And this is about as simple as that. Now, once you put on the mask, that's it. You don't touch it. You don't need to wear gloves. I like personally to wear gloves. If I'm going to be cleaning something, like if someone's sick and they're in a room and I want to clean the room, I would definitely recommend you wear a mask. And if you're going to do cleaning, a pair of rubber gloves. Now, like I said, once you put the mask on and you're touching things and you start, and because the mask will get itchy, the mask will move around, your instincts are going to be well, I got to adjust the mask. Well, you just contaminated the mask and you brought potential germs right towards your face. So every time you're touching the mask, consider it contaminated. Now you're breathing in through a contaminated mask. So, like I said, gloves, I'm a firm believer in gloves, but just because you have gloves on doesn't mean it gives you permission to get reckless. And I've seen people shopping in Walmart and Rouse's, and they're wearing gloves, and they're touching the baskets, and they're grabbing things off the shelves, and they're adjusting their mask, and they're scratching their face, and then their phone rings, and they're sticking their hand in their pocket, they're answering their phones, and everything they touched is now contaminated. You have, especially like if you go out in public, you have to assume that every surface in that store is going to be contaminated. So when you do have gloves on, it offers you a layer of protection, but try and remember this: when you have the mask on, you have to be extremely mindful that I will not touch my face. I will not touch my face. And I think the average person probably touches his face over 20 times in an hour without even realizing it. So once you have your mask on, if you need to readjust the mask, you need to do hand hygiene first. That means you need to clean your hands before you start adjusting it. Once the mask is on, it's on. I recommend everyone carry hand sanitizer. It's really easy. Keep it in your pocket. If you don't have access to water, at least you have hand sanitizer, which is way better than nothing. Now, if you are going to wear the gloves, you don't reuse them. You don't wash your gloves and reuse them. Same thing with the disposable. These paper masks, they're disposable. You throw them away. You can't clean these. Now the cloth masks are a different thing. You want to reuse the cloth mask, but you have to wash them. And putting them through the laundry cycle and drying them in a dryer is sufficient. You don't have to go through anything other than just wash them with regular wash cycle and make sure you dry them. Now, if you are wearing gloves, to take your gloves off once they're dirty, let me see if I can. You want to pinch the edge of the glove without touching your skin, and then peel off, and then ball it up. ball it up. Wait, I can't find my camera, I'm sorry. Yeah, ball it up. So I have the glove here. And from here, you want to stick your fingers on the inside of the glove, not the outside, but the inside of the glove, and peel it off. And you have the inside of the glove. And that way you're not touching anything on the outside of the glove and just throw it away. I guess that's about it. If all we're going to cover is gloves and masks. Maybe we can get aprons and face shields later. But I don't think we really need those, to be honest with you. I think the best thing we can do is social distancing. Even if you are together, at least keep six feet apart. If you're wearing that cloth mask, like for our facility, I think putting masks on the clients that are new and keeping masks when we interact is about the best that we can get, and that's probably all we really gonna need anyway. We're not like touching anyone. I think that the risk is when you're in a room and it's closed and there's no circulation and you're in a room for sustained contact. So maybe like if we're doing like a therapy session for an hour, that would be a risk. That would be something I would be concerned about. So we may have to look at using the Clare Hall, bigger spaces with better air circulation. I wouldn't feel comfortable sitting in my office doing therapy sessions with people that are unknown. Because we have symptomatic people that they're sick, they're coughing. We have asymptomatic people that are sick and have no symptoms. And then we have pre-symptomatic people that are infected and haven't developed enough of the symptoms yet. And those are the people that the masks are intended for. And that's really, it's about the person that's sick wearing the mask. That way they're not coughing and spreading germs all over the environment to protect the ones that aren't. So we don't know who's sick and who's not sick. You could be sick right now and not know it. So, I mean, we have an obligation to protect ourselves, but also to protect everyone else around us. I certainly don't want to get anyone sick. I don't want to be responsible for that. So I'm going to do my part and hope everyone here stays safe and does the same. Do you have any kind of questions? It's real simple stuff. I mean,
Yeah. I've unmuted everyone. Brooks, we can see you right now. But if you have any questions, just go ahead and ask.
So there's not going to be any clients, you said, coming into the building. So there's not going to be any extra masks for anybody then, is that right?
We have a few masks for us that if we need them, but yeah, we're not bringing clients in right now.
not now, not yet.
Yeah, no, even into our offices, we're not.
And here's the thing. We want to screen everyone before we take anyone in. Do you have a cough? Have you been exposed to someone that has the virus? Have you been out of the country? Do you live in an area where there's a lot of incidents? Have you had a fever? Things like that, basic things can tell you a lot.
So if we're going to have a screening form at all of our facilities before we, so for us to go into the office, we'll have to fill out the screening form where we'll take our temperature and we'll answer yes or no to a series of questions.
Yeah,
how's it going to work for like the postman and the UPS guys?
I'm not exactly sure how they're doing that, Jennifer. I know they have protective measures in place.
Or people that's every day working in Walmart or Target or everywhere else that's exposed every day,
Right. I know, all I can tell you from the medical side, I know people who are working in the medical side, that doing the same exact thing we're doing. Before you can walk into the office, before you can see clients or patients or whatever, you're taking your temperature, you're answering the questions. With this thing, there's no guarantee that someone's doesn't have it, minus getting the testing. And now that testing is just now getting started and available to the public. We don't have a good way of knowing who is and who isn't. All we can do is say, have you, and even the questions are, have you been in contact with people with COVID? Or are you a person under investigation? Or have you been in contact with someone under investigation? And it does really rely on us being honest. And just on top of that, that protective gear. So any other questions for Billy? Thank you, Billy. We really appreciate it.
No problem.